Welcome to INOvators, a series where we sit down with thought leaders across the healthcare space to discuss some of the industry's most pressing topics. For those of you who follow our podcast, you know we've hosted some pretty incredible guests across various facets of healthcare and technology, and this episode is certainly no exception. Joining me today is former director of the Centers for Disease Control and Prevention, Dr. Rochelle Walensky. From her years as a professor at Harvard Medical School to her time as the chief of division of infectious diseases at Massachusetts General Hospital, to chair of the Office of AIDS Research Advisory Council at the National Institutes of Health, to serving as the director of the CDC during the COVID-19 pandemic, Rochelle is truly a force in the healthcare industry, and I'm honored to be sitting down with her today. Rochelle, it is so wonderful to have you here.
So delighted to be here with you at Inovalon and with your Justine.
Thank you. Now, I could sit here and ask you questions for hours, and I know that the audience would listen, but I will try to stick to the most pressing. And I'm sure you can anticipate what the opener is going to be, and it is pandemic related. As someone who has played such a critical role in the last pandemic, we're all eager to hear your perspective on how we can better prepare for future pandemics. And with AI being such a hot topic in healthcare, how can it play a role?
Right. This is obviously really important just at this moment. We are right now in the United States and across North America in the midst of measles outbreaks across the country. We've had challenges with H5N1, and I suspect those will continue. And people have said to me, what is the next pathogen you're worried about? There have been viral hemorrhagic fevers, Ebola outbreaks over the last several years. I think the real issue is we don't know which pathogen will be the one that causes the next big challenge. What we do know is that our preparedness has to extend across all of them. And that means, in my mind, preparedness across three different areas. One is workforce. Do we have a workforce that is ready to respond both at the agency level, at the federal level, and then at the individual state level and globally? Do we have data systems that are ready to respond? Do we have data systems that are connected to one another that can convey information really quickly so that those data systems, people can talk to one another? And do we have laboratory systems that are ready to respond? Or are laboratorians upskilled? Do they have the technology at those potential points of where pathogens might emerge internationally and domestically to respond to any outbreak? So if we have a really robust infrastructure for public health, then we would be able to tackle any one of those pathogens should they be a problem. There are lots of different ways that artificial intelligence could potentially play a role here, and we're already using some of those ways. So when I think about surveillance, could artificial intelligence be able to signal an atypical constellation of symptoms in one area of the country and then the same constellation of symptoms in another area and flag those as potentially connected to an atypical pathogen? Could we use artificial intelligence to help screen the massive amounts of genomic data that we're going to be getting from wastewater testing that we continue to get from bacteria, viruses in wastewater detection? When we think about how we could use it for forecasting and modeling where the next outbreak might occur, how severe it will be, how many hospital beds we will need, how much PPE and supply chain management we will need, the ability to forecast how big the risk could be in all of those different domains is something artificial intelligence could be really, really helpful for. And then finally, vaccine development. Could artificial intelligence use protein folding and to use other characters of the virus to understand where we might target the next vaccine, which is the one that's most likely to be viable for a vaccine candidate? So I think that, that's just a collection of a few, but there are a lot of different ways that artificial intelligence could be helpful.
And that kind of leads me into my next question on another topic of healthcare right now is physician burnout. It's becoming a worsening problem due largely to a physician shortage. How do you see AI impacting that area?
Right. So it's anticipated in the next 10 years, we're going to be about 140,000 physicians in deficit in this country. And so what that means is not only do we have to protect and move forward with a robust physician supply, so we do have to do more things to promote the supply, but we need to retain those people who are in the system, those physicians who are doing incredible frontline work. AI can be super helpful here too. So everything from sort of what I call decreasing pajama time. So all those late night evenings that physicians are working to update their notes or to do prior authorizations, can AI be helpful? Yes, in streamlining the note-taking process, in understanding, like templating prior authorizations based on data from a patient's chart. Can it be helpful in scheduling? Can it be helpful in response to all of those queries that patients get, in being able to draft responses, template responses for a query about access to a medicine or a side effect of a medicine, a side effect of a vaccine that might be templatable? So I think there are a lot of different, and then one other way that it could be really helpful is in diagnostics. So can it be helpful in creating a diagnostic differential diagnosis, but also in our radiologic capacity or our colonoscopy capacity to say, I hadn't detected something with my naked eye, but there's something that AI can detect. Is this an early lesion? So in enhancing our ability from what the naked eye can do in all of these detection capacities.
There is so much good that can be done with all of this technology and the data, which is another big word in healthcare. And, we know there is certainly no lack of healthcare data available, but how do we use it to make better outcomes, to improve the lives of the people that all of this is impacting?
I think there are two huge topics related to data, and I'll stick to domestic right now as we have this conversation. One is our data highways. So once we have the capacity to have all of this data, and AI is helping here, do the data highways connect? This is a real challenge in healthcare and public health. Our data in our healthcare system is in one space. Our data in our public health system is in another space, and they don't connect to each other. The data highways don't speak to each other. So, for example, when I served as CDC Director, the vaccination data for COVID vaccines were in the public health infrastructure. The data on hospitalizations and death were in the healthcare system. And if you asked me the question, who is vaccinated is hospitalized, I couldn't connect the two. And that was really, really challenging as we were trying to make decisions with the best data that we could. So we have a highway problem. We need to have everything from our local public health departments to our state public health departments to our federal agencies like the CDC to be able to use the same data highways. And then we need to connect those data highways to healthcare record systems, something like Epic or Cerner that is used in so many hospitals right now. I'll give you a little anecdote, and that is in 2016, the healthcare system that I worked in went to Epic, and it was a huge lift for all of us to really understand and convert from the system that we had been in into Epic. That said, I vividly remember being on clinical service one day, and a patient who did not speak English had come in and needed to go to the operating room. And I was called because he had a lesion on his chest x-ray that made folks worried about tuberculosis, and he was from a tuberculosis endemic country. So the question was, we need to delay the surgery until we figure out what's going on with this potential tuberculosis status of this patient. And I was able to go in to Epic Everywhere, which is a feature of Epic, and see this patient's care in another hospital system, and to see that the TB status had already been addressed and he had already been treated. And that facilitated his ability to go to the OR probably by days, and facilitated his care. So we really, I can give you anecdote after anecdote of the ways that this system, when it talks to one another, has the ability to improve patient care and to improve health and public health.
Well, you said you have some more stories, and I would love to hear them, because we do focus so heavily on technology and data, and the people, the patients, they are at the end of it. So do you have any other examples on, where you have seen those positive outcomes as a result of all these technological advancements?
Oh, yeah, there are so many. But, another one of my favorites is I remember on a Sunday, I was in Ho Chi Minh City in Vietnam, and we were doing a field site visit to a elementary school that had been closed. Obviously, it was a Sunday, but what they were doing instead was tuberculosis screening for elderly patients. And they had about a 6-pound machine that was a chest X-ray, and it was being read by artificial intelligence. So you could, on a random Sunday in Vietnam, help do tuberculosis screening in real time, giving folks preliminary results based on an AI read, which was really extraordinary.
That's we've actually talked about that story, and I'm glad you mentioned it today because it's very impressive, and it's great to see that all of this technology is really making a difference. Now, of course, there is still ways to go. So, if you could wave a magic wand, where would the U.S. focus efforts in the healthcare space?
So both in healthcare, I do think we have, one of the big challenges in healthcare is going to be access and workforce challenges. We do know that in the places that have, this is correlation, not causation, but the places that have the lowest density of physicians, for example, also have the lowest life expectancies and highest burdens of diseases like COPD, like hypertension, like stroke. And so, if we had more access to physicians and to the services that physicians and their extenders offer, then we potentially could have better outcomes. And so that means extending the workforce, but it also means extending what the workforce does. So AI can play a huge role there. So, as I said, it's kind of back to the personnel, the data systems, and the laboratory systems, both in healthcare and across public health. And I think that infrastructure has to be fostered. So from a policy standpoint, I think we have a lot of work to do to foster every channel of those three. One other piece that I think is really important is once we have the data systems in place, those highways are connecting. Another really important piece is to ensure the privacy protected ways to have authorities to have those data systems connect. So it's one thing to have the ability to have them connect. It's another thing to have the policies available so that they can connect. And both of those need to happen. And a lot of that work is by policymakers.
Okay. Well, certainly hope that, we continue heading in the right direction. And before we close today, you have held some really impressive roles and done incredible things across healthcare. So do you have a favorite memory, or is there something that you're the most proud of that you can share with us today as we close?
It's probably the smallest things that you might not even have crossed your radar. When I came to CDC, you can imagine the morale of the agency in the middle of a pandemic was really difficult. And, the things that I'm really proud of are the ways that I was able to demonstrate how valuable each of those individuals was to the agency. The work of those people, the business card says 24/7. They're always on call, and they go above and beyond in incredibly selfless ways to serve the American public without any, totally out of the spotlight. And so for me, those beautiful moments were when I could talk about the agency and people would give them a round of applause, or I could call a single person and somebody who rappelled out of a helicopter to drop test kits on a cruise ship that was, stuck out at sea, and to just thank them for the work that they did and to hear their stories. So it's really those small moments to raise the awareness of what public health does and how they do it with such selflessness. That are the most proud moments of my tenure there.
Rochelle, I think for those who don't know you, you could look at all of the amazing things you've done, but I think that story even just speaks to who you are as a person. It's very touching, and of all the things you could have said, I think that's very cool. So thank you. And like I said, I could sit here for hours and not run out of things to talk about. So maybe that just means that we're going to have you back for a part 2. But
always delighted.
Rochelle, it has been a pleasure. And thank you so much, not only for being here today, but for the indelible mark that you have left on the world of healthcare.
Thank you so much, Justine.